Hello and welcome. My name is Joseph, and in this video I will be giving a brief overview of what athletic training is and what these professionals do. I'm currently in my second year of my master's program at Northern Arizona University, and I'm currently placed at Phoenix Rising FC, where I'm finishing up my rotation so that I can become a certified athletic trainer. In the past, I have been asked about my profession, about athletic training, and as soon as I answer with I am an athletic trainer, people tend to reply in one of two ways. Either you must be very fit. Whenever I get this response, I assume that they think I'm talking about personal training, which is not what this profession is. And the second response they typically get is, what is that, or what do you do? Um, and usually if I do not have time to expand on the answer for that question, I just answer quick and say, do you know in sports when an athlete goes down? And they usually respond with a yes, and I just go on to explain or go on to say, well, that is what I do. I go in and take care of injured athletes whenever they go down. But that is not the whole answer. The whole answer is a lot more complex than that. Athletic trainers usually do a lot more stuff behind the scenes than what people actually can see. For those of you that may want a formal definition, the National Athletic Trainers Association defines athletic trainers as highly qualified, multi-skilled healthcare professionals specifically trained in the prevention, examination, diagnosis, treatment, and rehabilitation of medical conditions and emergent, acute, and chronic injuries. Like I said in the previous slide, we are not personal trainers, which we are confused for more often than not. We're also not physical therapists, which is what we also get confused for. It encompasses some of what physical therapists do, but not all of it. Also, in multiple occasions, I've heard stories where athletic trainers are just referred to as trainers. We are not trainers. That is a term that can mean several different things. Like I said, the first thing that comes to mind hearing trainers is personal trainers. There's nothing wrong with personal trainers. It's just that we cannot be confused with that, because then neither of the professions get the recognition that they deserve. And the proper way to refer to us is as an athletic trainer or a certified athletic trainer. On this slide, there is a brief history of athletic trainers. Feel free to pause and read through if you want. I'm not going to go over each bullet point that is listed here, but as you can see in the very first bullet point, athletic training has been around for thousands of years, yet it was only recognized as an allied health profession by the American Medical Association in 1990. That's only 32 years ago. So if you want to put it into perspective, it is a fairly young profession, and work is being done for it to get the recognition that it deserves. By the year 2004, all athletic training students were required to graduate with a bachelor's degree from an accredited program. Now, 18 years later, that bachelor's minimum requirement has been bumped to a master's program from an accredited program to become an athletic trainer. Here in this slide, we have arguably the two biggest or the most important organizations for athletic trainers. On the left side, we have the National Athletic Trainers Association, the NATA, and if you can go back, it was formed in 1950, 72 years ago. The NATA is the professional membership organization for certified athletic trainers and others who support this profession. 5 years after its foundation, there were only a mere 279 members that were part of it, and today there are over 45,000 people. So it goes to show that this organization and profession has really come a far way. On the right, we have the Board of Certification, which is also known as the BOC. At first, the BOC was part of the NATA, but in 1982 it gained independence from the NATA and it became its own organization. The BOC focuses on creating the certification exam for future athletic trainers. It is an exam that athletic training students must take and pass in order to become certified. The BOC also plays a big role in coming up with continuing education units, which is CEUs, and they are units that athletic trainers must complete every 2 years. They have to complete 50 CEUs every 2 years to continue with their certification. In this slide, as you can see, there is athletic training roles and responsibilities that we have. There are 5 domains that encompass athletic training. They're listed here: injury/illness prevention and wellness protection, clinical evaluation and diagnosis, immediate and emergency care, treatment and rehabilitation, and organizational and professional health and well-being. Like I said in the previous slide, one of the domains is injury and illness prevention and wellness protection. Within this domain, we do equipment fitting, which includes shoulder pads and helmets. We also enforce wearing shin guards and mouth guards in sports that may require it, or thigh pads in football, or any other equipment that may be needed. We also are in charge of deciding whether or not athletes can participate depending on weather. So if it's the summer, for example, and it's too hot and too humid, we should do what a prudent athletic trainer would and either call off or delay practice. The same thing can be said when thunder is nearby or when temperatures are too cold. We also have the responsibility of having pre-participation examinations for all of our athletes to indicate that they're all healthy enough to participate in their respective sport. We also do training in proper lifting techniques and proper exercise techniques, such as running and cutting, jumping, landing. And we also provide taping techniques to our athletes to provide support to aspects of their bodies that they may need. For example, we can provide ankle tape jobs, and this may provide them with the stability that they may need in order to be safe when participating in sport. We can provide proper knee braces if needed. We can provide shoulder wraps if they need it too. Anything really, just so that they can be able to participate in sport. Here we have another of the domains that were mentioned previously: clinical evaluation and diagnosis. And in this domain, it is just that when an athlete comes into the athletic training room or to an athletic trainer, it is our responsibility to perform an evaluation, and part of the evaluation is what is known as a SOAP note. SOAP standing for subjective, objective, assessment, and plan. Subjective means that we record everything that the athlete has to say to us. Objective means that we include everything that we see or anything that we may test on the athlete, and assessment is just what we think that the injury might be, and plan is how we plan to tackle this injury or this incident and to return the athlete to their sport. In part of the objective portion of the SOAP note, we may perform a series of special events for certain injuries if we suspect one. For example, we may perform a anterior drawer test for the ACL, or we might perform rebound tenderness where it might be an appendix issue, if we notice that the athlete has jaundice or a yellowish skin, that might indicate a liver issue. If they have referred pain somewhere in their body, that may tell us that they may have organ an organ issue. It is also our responsibility to perform concussion evaluations for our athletes with the uprise in attention to concussions. It is in us to put in our effort to increase this and bring awareness to concussions and make sure that athletes don't compete if they are concussed for their health. We may also look for mental health signs and symptoms so that we know when to refer if needed. Here we have a third domain, which is immediate and emergency care, and in this domain it is our responsibility to know when to activate emergency medical services, like in what situations we may want that. For example, if an athlete goes down and a neck injury or a spine injury is suspected, it is time for us to do so. There may be situations where we may need to act immediately and perform CPR on the field to save an athlete's life. It may sound drastic, but it has happened before, and it probably will happen. We also need to know how to act when there is a fracture at a limb, and we have to be able to immobilize with SAM splints, or we have to be able to know what drugs to administer or suggest to athletes who may be sick or who may have a certain pain. And we have to be able to recognize diabetic comas so that we know how to act in those situations. We also have to be able to perform wound care if needed. This includes the use of tourniquets if there's profuse bleeding, so that the athlete is in the best of hands when the proper teams gets there. Here we have a fourth domain, which is treatment and rehabilitation, and in this domain it is up to us to make the best calls so that we can provide the athlete with the best care possible. The care that we provide is obviously within our control, so we have many options to choose for an athlete who is injured. We can choose between electrical nerve stimulation and superficial cold therapy. We can also provide a rehabilitation program for our athletes where they perform certain exercises, and after a few sessions we can choose to progress them so that they can get stronger, and we can prepare them for returning to sport as strong as they were pre-injury, so that they don't re-injure themselves and that they compete to the level they were at, like I said, before their injury. Another service that we can provide for them is manual or mechanical therapy, so that this can help them get better faster too. Also, in some instances, we may have to keep track of any medications that athletes may be taking in order for them to compete. As you can see here, we have the final domain, which is organizational and professional health and well-being. And this domain encompasses many documents. We have medical records. Medical records help us with knowing what we're dealing with if an athlete has a history of any known injury or illness or disease. We also have to have policies and procedures for certain situations that may arise. We also have to advocate for the profession. We can do it at a federal level or a state level, or even as low as just our patients, and educating what our profession is, or just telling the general public. We have to deal with insurance and making sure that reimbursements are made We have to come up with budgets for the supplies we may need for the season, and we also have to come up with the plan of care for non-athletes. This includes, at certain events, sporting events, if a member of the audience goes down, we have to make sure there's a policy and procedure for who's going to take care of that. If a referee goes down, if a coach goes down, we have to make sure that there's a plan for all of that. On top of those 5 domains that were mentioned, there's also several useful subjects that will be useful for us to know. These include the lists that are here: nutrition, psychology, evidence-based practice, physics, pharmacology, and physiology. You may be wondering where athletic trainers work or where they are employed, and here's the traditional job settings for them. So colleges and universities, secondary schools, clinic and hospital, and most people may think of professional sports when thinking of an athletic trainer, but curiously only 2% of athletic trainers work in professional sports. There are also emerging settings where athletic trainers can work, and these include performing arts, public safety, the military, and occupational health. As mentioned previously, we are allied healthcare providers, meaning that we are part of the health economy, if you will, and we work with several other healthcare providers. These include the school nurses if you're in a secondary school setting, psychologists, dentists, etc. The list goes on beyond what is on this slide, and it is our responsibility to be knowledgeable in when it is a good time to refer these athletes to another healthcare provider if necessary. For example, if a patient suffers a dental injury, it might be a good idea to refer them to a dentist. If they have any musculoskeletal injuries, take them to the orthopedist, or refer them to an orthopedist. With COVID being 2 years old, up to this day, there are athletes who suffer the long-term effects of COVID, and we may have to refer those athletes to cardiologists so that they can get extra work done and make sure that they are healthy to keep participating in sports. When an athlete tears, for example, an ACL, we have to work with physical therapists so that the athlete gets the best care possible. If an athlete is portraying with, depression or anxiety or an eating disorder, we may want to refer them to a psychologist because they are specialized in that work. Athletes also come in for nutritional advice. We have some knowledge in it. Not all of us have as much as we would probably want to, so we can also refer them to a registered dietitian for that. And this is the end. Thank you for sticking around and watching. I hope you learned something from what an athletic trainer does and what an athletic trainer is. Take care. Bye-bye.